Going to the hospital, whether it's planned or unexpected, can feel overwhelming. And once you're there, moving between departments or preparing to go home can bring its own challenges. That's why we're here to help. Hello, my name is Gloria Radzius, registered nurse with the Geriatric Emergency Management team.
And I am Cyline Adam, a social worker.
In this video, we'll share simple, practical tips to make hospital transitions smoother, whether you're arriving, moving within the hospital, or getting ready to leave.
First, we will talk about the transitions to the hospital. Whether going to the hospital is planned, like for a booked surgery, or unplanned, like coming to the emergency department for an urgent problem, being prepared can make the transition smoother. Here are things you can do to prepare for coming to the hospital. Ask questions. What will the hospital stay be like? What should I bring? How long will I need to stay? What will happen while I'm there? Gather medical information. Make a list of your medicines, allergies, and any medical conditions. This list will help the hospital staff understand what care you may need. Bring personal care, medical, and daily items, comfortable clothes, glasses, hearing aids, and dentures, mobility aids like a cane or walker, a list of important contacts and phone numbers like family members, doctors, and an emergency contact person. Personal items like soap, toothpaste, and any other items that will make you feel comfortable. Important legal documents like advance care directives and power of attorney information. Arrange transportation. Make sure someone can bring you to the hospital or have a plan on how to get there.
Next, we will talk about what you can do to help make your hospital stay easier. Have visitors. Have family members and friends visit as often as possible. Seeing or talking to someone familiar while you are in the hospital can make you feel more comfortable. Family, friends, or care partners who know you well can also tell if you're not acting like yourself and can let the hospital staff know. Ask questions. If there is something you do not understand about your care, ask the hospital staff. They will listen and answer your questions. Ask for help. If you need help eating, using the bathroom, or getting out of bed, let the staff know. They will help you with the care you need. Be patient. Sometimes things may take longer than expected. Hospitals are busy places, but we will do everything possible to get you the care you need.
Sometimes care transition happen within a hospital, like when you need to move from the emergency room to a regular room, or from one unit to another. Here are some tips on how to make the transition within the hospital smoother. Ask questions. Ask your care team what to expect when you move to a different room or area of the hospital. Ask them what you need to know about the new place. Bring important items with you. If you move to a room, make sure you have all your important things, like glasses and personal items. Let your visitors know. If you are moving to a new part of the hospital, let your family and friends know so that they know where to visit you. Give them a contact phone number for the new care team so they can ask questions too. Your care team can help with this.
Now let's talk about transitioning from the hospital. For most patients, the goal is to return home after their hospital stay. At the Ottawa Hospital, we follow a home-first approach, meaning we start planning for your discharge from day one. This gives us enough time to arrange the right home supports and services so you can leave the hospital safely and with confidence. Here are some tips to make leaving the hospital as smooth as possible. Understand your discharge instructions. The staff will explain everything you need to know and do after leaving the hospital. Before you leave, they will give you a written summary of the hospital stay, including a list of your new medications, clearly noting any changes or medications to stop taking, a list of exercises or physical therapy to continue at home, any new mobility aids you may need, such as walkers, canes, or crutches, your follow-up visits with your doctor or other healthcare professionals. Ask questions to fully understand your discharge instructions. Know your home supports. Some people need extra support after leaving the hospital, like home care or physical therapy. Know what you need and how to arrange it so that you can continue healing at home. Prepare your home. Get your home ready so that it is comfortable and safe for you. You might need to set up things like a hospital bed, ramps for easy walking, or a bathroom that is easy to use. Sometimes you might need a family member or friend to stay with you right after going home. Ask your care team how to make these arrangements if you are not sure.
Here are a few final tips to help with the transition to, within, and from the hospital. Take notes or ask someone to help you to keep track. Write down important tasks to do before, during, and after the hospital visit. This will help everyone stay organized. Get to know the hospital team. The staff at the Ottawa Hospital is here to help. We care about all our patients and want to work with you for the best care. Stay patient and positive. Care transition, like any change, can be challenging at times. But with patience, asking questions, and following some of these tips, transitions can go smoothly. Take care of yourself. You are the most important member of your care team. Taking care of yourself is the best way to continue to heal and achieve your best health. Ask for help if you need it. This is equally important for your family, friends, and care partners. Caring for someone is not easy, and taking time for their own health and well-being is very important.
We hope these tips will help you and your loved ones make any care transitions easier. For more information on your stay at the Ottawa Hospital, click the link in the description. Remember, being prepared, asking questions, and taking care of yourself will make a big difference. Thank you for watching.